Hello everyone. I'll start in a minute. Just waiting for some people. Can you hear me now? Okay, window. Just перезапускаю. Наш экран. Okay, what about now? Can you hear me? Okay, perfect. Okay, YouTube is shitty, but whatever. Let's get back. Yeah, let's cover what we learned in part 1. So VO2 max, maximum oxygen uptake during exercise. Amount of oxygen that you breathe and your body can process, so you can use that amount of oxygen, because not all air that you breathe during the day or during exercise, your body use, right? And why it's important? It's correlated to cardio health and longevity. So basically, to put it simply, the better your VO2 max, so the more oxygen your body can process during exercise, the better. And cardio activity helps to improve VO2 max. So if your number is low right now, you can improve it just by doing some cardio activity. Now let's go to cardio activity guidelines that we discussed last time. Yeah, moderate activity, it's like zone 2 so-called, or a bit lighter. It can be like some brisk walking at high pace, very light jogging, maybe very light cycling, like gardening also, like 150 to 300 minutes per week. So if you walk every day, it's more or less fine. Like, depends on the amount of your walking, but yeah. Vigorous activity, 75 to 150 minutes per week. Here is like jogging, about 8 maybe to 10 kilometers per hour. So like pretty active, not all out, but pretty active. So at 70 to 85% max heart rate. Yeah, cycling, swimming, yeah, rowing, so everything that pretty active, right? And ideally that you can do for like a prolonged period of time and keeping the heart rate at that level. And consistency is key for boosting VO2 max and overall heart rate. So it makes sense to spread your workouts throughout the week or during the time, and just be consistent to improve it. And also we covered sedentary lifestyle and lack of non-exercise activity, thermogenesis. What does it mean? Yeah, so we all sit every day, all day. So like, a lot of people work at the offices, or like even, I don't know, doesn't matter, supermarket, like some factories, but mostly we just sit in front of computers, in front of something, just looking at screen, and we don't move much. But our bodies, they need a lot of movement, because like previously, right, so like for generations, like a few thousand years ago, people always moved. They did, I don't know, like hunting, gathering, doesn't matter, but they moved a lot. And our bodies, they really need that, like maybe not all day, but fair amount of movement. And if we sit all day, that can have some negative impacts. To be honest, it's like one of I would say like negative habits, if like, you can say so, right? So just prolonged sitting without movement. And exercise snacks can help to offset the negative impact of it. It's basically just short bursts of activity from 1 to 5 minutes. It can be like going up the stairs, for example, just go on stairs, go like a few stairs, floors up, down, you're done. Like you can continue doing what you need. Some squats, maybe like 10, 20 reps, push-ups, the same. Just do some activity from 1 to 5 minutes. If you do like some squats, push-ups, maybe 1 minute, jumping jacks or something like that don't take a lot of place. You can just walk around if you want. That's also fine. Perfect. Maybe just walk a bit more, like so not 1 minute, like more close, like 3 to 5 minutes. just walk around the office or where you work. Like you can just get out, walk around the building, get back. Perfect. It will be like 5-10 minutes, ideally. Daily walking. Aim for 8 to 10,000 steps a day, or just do small you can do like small frequent walks, 5-10 minutes each, like exercise snacks, or you can do one long walk. But ideally, it will be both. Like do some one long walk a day at least, like 30 minutes, something like that. Just for your understanding, like about 10 minutes walk, it's 1,000 steps. So ideally, it would be like 80 to 100 minutes walking a day. But it's like walking at home, walking at the office, like everywhere. So it also counts. But yeah, ideally, it would be like one long walk and a few like short walks. And yeah, try to do some more general activities. Stand or pace during phone calls. Use stairs rather than elevators. So like just keep your activity at some level. Now let's switch to topics of the day. We'll talk about benefits of exercise, hypertrophy training, strength training, and injury prevention. But first, I want to share with you this quote. Exercise is like brushing your teeth. You need it for health. As you pick brush and toothpaste you like, pick type of exercise and activity you like. To put it shortly and more simply, that to be honest, it doesn't matter what exercise you do. If it's some sports, if you go to the gym, running, cycling, it doesn't matter. Only what matters is you do it safely and you exercise. So you do some activity. That's the main point. Ideally, it would be combined like some strength and hypertrophy training, so like resistance training and cardio training. That would be the best, as it. But in general, like just do whatever you like with exercise. Okay, now let's talk about longevity and health. Yeah, exercising isn't just about weight. Fitness is a key factor. So yeah, it doesn't matter if you're overweight or not. Exercise still will benefit you a lot. Research shows that higher fitness levels reduce the risk of premature death. So yeah, it's like a very good point for longevity that people need a lot of exercise. Not a lot, but like at least a decent amount of exercise. And physical activity improves both physical and mental health. There are a bunch of studies that note that physical activity can reduce depression, help with other disorders, like improve mood significantly and stuff like that. Now let's talk a bit about muscle and bones health. I'm not sure about if you know already, but we have age-related decline of muscle and bone health that starts around 30, maybe 40 years old when we are. So it's different for everyone, but still. And resistant training and proper nutrition can counteract these declines. And it's important to incorporate strength work to offset it in any age. Let's just make a quick example. For example, two people, both 20 years old, both don't exercise. First one starts exercise at 20. They both have at 20 like their muscle mass or like bone density, it doesn't matter, like 100. Let it be muscle mass. They start to exercise. One starts exercising, his muscle mass increases to, let's say, 150. Yeah, right. So like within 10 years, when he's 30, it will be 150. For another one, it doesn't change from 20 to 30 much, so it will be the same, 100. And at about age 30, maybe 35, 40, it's muscle decline, age-related muscle decline starts. And it declines about 1% per year, or on average, if you don't exercise. If you don't do anything, so 1% per year. So for the person who doesn't exercise, from 100, let's say go to 60 years old. So it will be like 30 years, and you're like within 30 years, you have around 30%, maybe a bit less. So like from 100, you'll go like to 75, 70, 75. And for another person who has 150 points, say points, but just for perspective, it will be the same. It will be even more, yeah, because 1% from 150 is 1.5. So let's say like he'll lose 45 points. But at 60, he'll have around 100, 105, maybe 110. And his muscle mass could be basically the same as it was in his 20 years when he was in his 20s. And it's really a huge difference. And when you get to lower points like 70, 60 points, 50, like when you get older, if you don't get enough muscle mass, it will be harder to move around, like go up the stairs, get your groceries and things like that. So it's very important to work out, to do some resistance training to improve your muscle mass and bone density. And also another thing that it doesn't matter, to be honest, at what age you start to work out. So okay, the earlier the better, but still the person can start to work out at 40, 50s, even 60 years old, and they can still get their muscle mass and bone density improved and offset the decline. So yeah, it doesn't matter. You just need to start if you still don't. Now let's talk about fundamentals of hypertrophy training. Yeah, key variables: volume, intensity, effort, and frequency. Volume is the amount of repetitions, the amount of work you do. Intensity is how intense, like amount of reps, like the period of your rest. Effort is how complicated is it, so like do you do to failure, or it's light for you, so you don't do to failure. And frequency is how often you do, so like once per week, multiple times per week. Rep range, typically for the hypertrophy training, rep range is like 6 to 12 repetitions with 1 to 3 repetition in reserve. So it's usually not to failure, like 1 repetition in reserve. So, and keep in mind that you need to maintain a very good technique. All exercises should be done with good technique. Exercise types. Compound movements, I think these are best for beginners and overall for everyone. So it's like squats, deadlift, bench press, pull-ups, push-ups, some bodyweight activities. So they target a lot of muscles, and they're pretty good. So you need to start with the basics before doing some isolation movements for targeted muscles. There's some more like for biceps, triceps, for like different parts of chest, like incline bench and stuff like that. So like some special for legs also. But ideally to start with, or have at least some compound movements and additionally add some isolation movements. Now let's switch to strength training essentials. And for strength training, we have the so-called 3 to 5 protocol, which is pretty simple, and you'll understand why in a second. Recommended approach: 3 to 5 workouts per week with 3 to 5 exercises per session. Basically, here it means that you can do 3 to 5 the same exercises, and you can do 3 to 5 times per week. Because when you don't do as much repetitions, like in hypertrophy training, it's usually 6 to 12. Here you'll see that it's 3 to 5 sets and 3 to 5 reps for building strength without excess hypertrophy. So your muscles won't be fatigued too much, and it will allow them to recover faster. So you'll be able to to do more sets within a week for the same muscle. And some key takeaways on training. First is choose the training style that you enjoy. Ideally incorporate both hypertrophy and strength training for some work for balanced fitness. And again, if you don't like gym, pick a sport or physical activity that you like. You can do some outdoors, like jogging, cycling, whatever. You can do some sport, tennis, I don't know, basketball, whatever you like, really. Just some activity. In most of sports, there's still some physical training, some resistance training, like squats, push-ups, to keep your physical level and improve it. So it's also fine. And again, regular exercise improves mood, cognitive abilities, and overall quality of life. So don't don't try to skip things that can really improve your mood, overall perception of your life. And don't underestimate the role of recovery and sleep in achieving results. Yeah, it's very important to recover properly. If you feel that your muscles sore and like you didn't get proper rest, then probably would be skip or do some more light activity to not push yourself too hard. And a bit about injury prevention. Proper movement and gradual progression are essential. We'll talk about it. Regular screening helps identify mobility or stability issues, and balancing intensity with recovery minimizes the risk of overuse injuries. Let's start with movement screening and assessments. There are some tools like functional movement screening. You can find a list of movements. It's like about 7 or 8 exercises, as far as I remember. They'll help to assess your level and prevent injuries. So their goal is to assess if you have some weak points, if you have some instability. So, for example, if your one side is stronger than another, it could also lead to some instabilities and potential injuries. And there are some additional tests like bodyweight squat, push-up, plank hold, grip strength, which is also important to just to understand your weak points. And as a result, yeah, you can customize training to address individual weaknesses, so you can focus on them. And yeah, first of all, it will prevent injuries, and yeah, it will help to improve other parts of your exercising, because you sometimes, almost, yeah, quite often, that weak points drag us, stall us, and don't allow to progress as fast as we want. Now let's talk about progression and load management. There is so-called 10% rule, and I think it's pretty good. So increase training load by no more than 10% per week. Just an example, if you do some, I don't know, leg extension with 50 kg and you want to increase your weight, don't directly jump to 60, for example. Use 10% rule, so 10% from 50 is 5, and try to do 55 for 1 week at least, yeah, and then you can increase more for another 9%, so it will be like 60. Yeah, don't jump a lot. The same is avoid too much too soon to reduce injuries. It's kind of the same, but maybe a bit different, yeah. So don't try like new exercises with heavy weight if you didn't do them before. Don't increase weight, don't increase amount of sets like too much without doing it gradually at first. And important also include planned deload weeks, especially if you train pretty hard. So around every 4 to 8 weeks, just decrease amount of sets, amount of trainings, reps. So for example, if you train like 4 times a week, do in deload week like 2 times a week maybe, or 3 times a week, and do it a bit lighter, so like less reps, less sets, maybe just do some different exercises that are easier for you. And a bit about technique, equipment, and environment. First of all, start with mastering fundamental movements before adding heavy loads and trying to do isolation, because uh, compound movements is a bit easier and a bit more safe, I would say, because there are a lot of muscles that work at the same time and they can compensate a bit. But if you start doing heavy weights with these movements or with some isolated, it can be a bit more injury potent, so like more high chance of injury. So start with more fundamental movements first. Check your equipment. Proper footwear and well-maintained gear. So try to check every time that gear that you use. Ensure training surfaces are safe and appropriate, so nothing just lays around where it's not needed and things like that. And small details can make a big difference in preventing injuries. And let's talk about recognizing and managing overuse injuries. Common signs: persistent pain, morning stiffness, swelling for some time. What we can do: early intervention, adjust activity levels. So maybe just decrease activity level, rest for some time. If it's not helping or it's getting worse, just seek professional advice. And again, emphasize gradual progression and listen to your body. So just how it feels, what you can do, and just still do it gradually. Respond to minor issues. The so-called RICE method: rest, ice, compression, and elevation, and active recovery. Gentle movement to promote blood flow and maintain mobility. And after that, return to activity, but firstly ensure that movement is pain-free that you plan to do, and the strength should be near equal that was before, or like with other side, for example, before resuming full activity. And want to add a bit about active recovery. If it's possible, do some active recovery. It's almost every case is better than just doing nothing. Active recovery could be just some gentle movement of muscle, or just do some very light activities. It can be also walking. It also promotes blood flow and helps to speed your recovery. And what's next that we're gonna be talking in next meetups: stretching, breathing, hydration, smart training, and a bit of advanced exercise tips. We will see. That's one my favorite. And final thoughts and Q&A. Consistency and enjoyment are key to sustainable exercise routine. So ideally, you would have some exercise routines that you can keep for a long time. So it's better than switching them or just doing, I don't know, 5 times per week and then just losing it, stopping exercise completely. So better to do it consistently. Adapt training and recovery strategies to meet your individual needs. So basically you build training on what you want, so your goals, that you enjoy it, and ideally have enough recovery to keep progressing. And that's simple. Make it a habit that you enjoy. So find what you enjoy. Maybe find a workout partner who you work out with, who motivates you. Find a goal. Find some sport that you enjoy. So find something that you really enjoy. So the best would be to get as much enjoyment as possible from exercise, and that will allow you to make a habit from it. But that's basically all from me. So if you have any questions, please write. The next meetup probably will be next week. We'll see. which one we do, it will be with which topics, but it will be next week. Okay, no questions. So yeah, thanks everyone for coming. I'll be there for a few days, I guess. So thanks for joining and have a nice day.